This tablet contains a combination of vitamins B6, B12, and folic acid, which are essential for good health. It is used to supplement the diet of individuals who do not have enough of these vitamins. Taking one tablet daily is the recommended dosage, and it is best to take it at the same time each day to ensure consistent absorption. Taking it with food can help improve absorption. You can take the Westab 2.5 mg, 25 mg, 1 mg tablet multivitamins by mouth, with or without food, usually once a day as directed by your doctor. If you experience stomach upset, you may find it helpful to take this product with food. Using this medication regularly will help you get the most benefit from it. To help you remember, try to take it at the same time each day. The dosage will depend on your medical condition and how you respond to the therapy. Some common side effects of Westab 2.5 mg, 25 mg, 1 mg tablet multivitamins include nausea, stomach upset, diarrhea, drowsiness, flushing, and numbness/tingling. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist promptly. If your doctor has prescribed this medication, it's because they have determined that the benefits outweigh the risk of side effects. Many people using this medication do not experience serious side effects. However, if you do notice any serious side effects such as mental/mood changes or unusual weakness, it's important to inform your doctor right away. While it's rare, a very serious allergic reaction to this drug may occur. Seek medical help immediately if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you experience any other effects not listed, it's best to contact your doctor or pharmacist. As for the best time to take this medication, it's important to follow your doctor's instructions on the daily dosage and timing. They will be able to provide you with the optimal timing for taking Westab 2.5 mg, 25 mg, 1 mg tablet multivitamins to ensure its effectiveness. Before taking Westab 2.5 mg, 25 mg, 1 mg tablet multivitamins, it's important to talk to your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that can cause allergic reactions. Make sure to also discuss your medical history, especially if you have certain blood disorders. This medication may cause drowsiness, especially when combined with alcohol or marijuana, cannabis. It's important to avoid driving or using machinery until you know how this medication affects you. It's also recommended to limit alcoholic beverages and talk to your doctor if you are using marijuana, cannabis. If you are pregnant, only use this medication if it is clearly needed and discuss the risks and benefits with your doctor. Additionally, if you are breastfeeding, consult your doctor before taking this medication. It's important to be aware of potential drug interactions when taking Westab 2.5 mg, 25 mg, 1 mg tablet multivitamins. This can affect how your medications work and increase your risk for serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Westab 2.5 mg, 25 mg, 1 mg tablet multivitamins include L-tretamine, cisplatin, levodopa, when used without carbidopa, folic acid antagonists, such as methotrexate, and hydantoins, such as phenytoin, diphenylhydantoin, pyrimethamine. It's also important to note that this product may interfere with certain lab tests, so make sure lab personnel and all your doctors are aware that you're using this product. If someone has taken too much Westab 2.5 mg, 25 mg, 1 mg tablet multivitamins and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's important to act quickly in these situations to ensure the person receives the necessary medical care. It's important to remember not to share this medication with others. Your doctor may recommend lab and/or medical tests, such as a complete blood count or homocysteine levels, while you are taking this medication. Be sure to keep all medical and lab appointments and consult your doctor for more details. While it's best to get your vitamins and minerals from healthy foods, It's also important to maintain a well-balanced diet and follow any dietary guidelines as directed by your doctor. B vitamins, including folic acid, are naturally found in leafy greens, other vegetables, and citrus fruits. Folic acid is also found in enriched grains such as bread, pasta, and cereal. Some brands of this medication may also contain ingredients such as vitamin E, para-aminobenzoic acid, or alpha-lipoic acid. If you have questions about the ingredients in your brand, be sure to consult your doctor or pharmacist. If you happen to forget to take a dose, you can take it as soon as you remember. However, if it's almost time for your next dose, it's better to just skip the missed dose and take your next one at the regular time. It's important not to take a double dose to make up for the missed one. It is important to store Westab 1 2.5 mg, 25 mg, 1 mg tablet multivitamins at room temperature, away from light and moisture. It's best to avoid storing it in the bathroom and to keep it out of reach of children and pets. When you no longer need the product or it has expired, it should be properly discarded. You can consult your pharmacist or local waste disposal company for guidance on the best way to do this. Remember not to flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.